Hi there, Andrew Zang PT here, and today a topic that I want to talk about briefly is images and back pain. And this spawns a little bit from what I talked about the other day in regards to treatment for spinal stenosis, but one thing that is very common in our society is back pain, and the question is, how do we treat it? And if you ask 10 different healthcare providers, be they a chiropractor, massage therapist, physical therapist, orthopedic physician, or a primary care physician, you're going to get different answers as far as how each of us feel back pain should be treated. But one thing that I think most of us can agree on is that images, be it X-ray and MRI, do not tell anyone how to treat back pain. Okay, there are certain instances where imaging may be necessary and may guide treatment. But for 98% of people with back pain, taking an image of your spine is not going to help anybody treat you, and in fact could be actually harming your care and your likelihood of improving. And why this is the psychological impact of what some radiologist reads your image as, basically. So as we age, changes happen on the inside. Just like change on the outside, you get wrinkles, your skin changes, your muscles get a little bit weaker, you may be a little bit less flexible. Well, your insides change as well. Okay, that's normal. It happens with age. You take a picture of anybody's back over the age of 40, it's going to show some signs of aging. And a radiologist is going to read this and use some words that scare people, like degeneration, severe, bulging, herniated. Okay, and some of these findings are in people who don't have any pain. So when they come out and they find them in somebody who has pain, that is pointing out, oh, that's the source of your problem. But is it really? Like I said, these findings are normal in people, and very likely that individual had that finding months or even years before they ever had pain. So it really doesn't correlate to anything specific, and that is one thing that I need everybody out there listening who has had back pain or who will develop back pain in the next year, because as we know by research, good 80 to 85% of people are going to have back pain at some point in your life. It's just a fact. It's not that it's going to be debilitating or prevent you from life. In some people it does, but it doesn't have to. And one of the most important steps is not rushing or pushing a doctor to have a picture on your spine, because it's not going to change how you're treated. Okay, again, there are certain reasons, and you can ask your doctor why specifically you may need it or not need it. But in most cases, it is 100% not needed and is a detriment of care. What does matter? How you move, how you function, what you can do, what you can't do, what you want to be able to do. Okay, these are the questions that people like me want to know. And that's how I'm going to help figure out how to help you get back to living life the way you want to. Okay? I'm going to find out everything that you can't do. I'm going to find out everything that bothers your back. And then I'm going to go find a movement or position or some intervention, strengthening flexibility, repeated movements, whatever. Whatever helps to take that pain away based on our talking and our examination, that's what we're going to do. And that's going to solve your problem, not me looking at any image. So that is a very important thing that hopefully everybody out there can begin to let sink into their brain and process, so that you don't push your doctor for something that actually is going to be a detriment and not really a help. Okay? If you have any more questions or concerns or comments on this, I'm more than welcome discussion on this issue, because it's something that is important to me and important to many physical therapists that I interact with on a regular basis, because we're looking to help people feel better without as much medical intervention. Okay, we spend a lot of time with treatments that aren't helpful, so we want to help people get better with the right treatment, and that starts with just talking. It doesn't start with any picture. Okay, so again, if you have questions, post in the chat board, email me, andrew@zangpt.com. But let's have a discussion. Let's figure out how to help your back feel better so you can get back to enjoying life the way you want to without feeling restricted. Have a nice day.